Thanks for staying with us. And there have been growing calls for proper information dissemination and enlightenment of the people about the coronavirus pandemic. These concerns come on the back of a growing call for the use of face masks as an effective measure in slowing the spread of COVID-19. The coronavirus pandemic has reached the third stage of community transmission and needs an aggressive sensitization of people in various communities to contain the spread of the virus, even as governments are ramping up tests across the states of the Federation. And it is said that communities should be made to understand the need to stay safe at this period. And questions have been asked about those that don't have access to clean water, the internet, and live in remote areas. How would they be properly enlightened about the importance of staying safe, even as the country's coronavirus figures continue to rise?
Each and every person coming into the camp is mandatory for that individual to wash his or her hands with under running water with soap, so that even if the person has had contact with any other surfaces or anybody suspected to be having such diseases, might actually not going to spread to other peoples within the camp. People are complying very well. The level of compliance, as you can see, is here. The securities at the gates are quite around trying to enforce. In fact, I even cited somebody who wanted to gain access to the camp, and then the person actually declined to wash his hand, and of course he was denied access.
All right, more on the COVID-19 information dissemination and enlightenment of the people. I've now been joined by Mallam Idi Farouk, who is the former Director General of the National Orientation Agency. Very warm welcome, Mallam.
Thank you very much for having me.
All right. Information dissemination is often been seen as a huge problem to letting the people know the efforts of governments, whether in social or economic building of the nation, or even political development as well. How, so far, will you rate the campaign over the COVID-19?
Tough question. In the very beginning, when the presidential task force was formed, I mean, they began with the same method that they still are using, which is everyday briefing to select media. And I think that in that wise, I guess they are talking to themselves, because it is not really reaching out to the people. Talking to select media houses cannot reach the people. Like you rightly observed, I headed the National Orientation Agency. And I think that there is one agency of government that is totally underutilized. I had calls to talk to any of the members of that committee that I can't talk to. There is the need to involve the National Orientation Agency. There is need to involve the National Council for Arts and Culture. There is need to involve the National Council for Women Affairs and Society, because this thing is supposed to be holistic. All hands must be on deck. It's not enough to reel out numbers as to, we have had this number today, 350 had come on board, 50 had been discharged, 50 had been cured, so to speak. So it is not going down. And until it gets down, we will begin to we'll continue to see the kind of thing we're experiencing today. God forbid, but it is my take that until the proper thing is done, and let people not keep to their own Nigerian Center for Disease Control good as it is, does not have mobilization powers. It has nothing to do with enlightenment. Basically, it can talk what he's talking now, that's all. So I guess that for it to go down and for us to succeed, every hand must be on deck. If you watch the news that I watch every day, watch the American television, for instance, or the American own approach to the COVID virus, all the media, every media, social, television and radio, everybody is talking about it, such that it becomes like a sing-song. But as we speak today, every day we have the same thing, reel out numbers, wait until tomorrow. It's not resonating well with the people.
Could it be a problem of funding? I mean, with your experience, yeah.
Excuse me, nothing to do with funding. In the first place, and I want to talk about funding, we hear from their various briefing on every day, Aliko Dangote has donated this, Issa Karabiu has donated this and all that. We do not know the total sum of what has been collected. And when you do get the total sum of what you have collected, you have to sit down as a committee and budget for every aspect that will make your work smooth and well. Meaning
the Minister of Information is there. He's a member of the PTF. So is he not putting in words about the information dissemination like you outlined using the National Council of Arts and Culture, for example?
Even while the Minister of course, even the Minister of Health is a member, but NCDC too is also a member. NCDC is like NOAA, or National Council for Arts and Culture, as it is as they are to Ministry of Health.
Yeah.
That's how NOAA and the rest are. Every hand must be on deck. The minister is at the policy level, but at the area of impacting on the people and taking this thing down to the grassroots, you require, and let me tell you, National Orientation Agency has 774
offices,
top government officials, not less than the level of level 13, 14, in some cases 15. They are a good asset for you to use. You can't keep them, and every day, of course, I hear, what are they doing? What can they ever do? If you keep the money for mobilization and enlightenment with NCDC or with the committee, how will they use it? How do they utilize it? And that is why we're having the problem. We have a big problem in our hands. And that's why I was happy when you invited me to come. I need to talk about this because it bothers me. Take the issue of the palliative, which is key to the success of lockdown. How is it being utilized? How much is there available, made available by government for palliative nationwide? We need to know. And when you do this, how do you want to dispense it? Just the way that every month the commissioners of information of finance come for FAC. When you have something in the basket for everybody, everybody should know what is in there, and everybody should know how you want to spend it. And until that is done, for goodness sake, Christian, we're going to run into trouble.
But one short vehicle that you mentioned is the use of the National Council for Arts and Culture, and they can dramatize the whole essence of COVID-19 and redistribute through the 774.
The National Council for Arts and Culture holds an annual event every year for all the culture groups in Nigeria. Every state has Council for Arts and Culture.
And they have a troop.
And they have troops. You get what I mean? So this thing cannot be a closed shop for this group of people here in Abuja talking to us. It needs and all-encompassing. And you see, I mean, that is the problem with Mr. President. Mr. President has a lot of trust in people. When he gives you an assignment, he expects that you do it to the best of your ability. It seems to me that they are not doing it to the best of their ability. And if this is to the best of their ability, then they are failing. I'm sorry.
And that could be the reason why we're having a spike of the virus, because of this ignorance and lack of enlightenment.
Excuse me. You saw it's going on social media. The grave diggers in Kano, didn't you see them? Didn't you see how they handle these corpses? Even them need orientation, because they have to know. They have families. But we are not just doing this thing right.
And you want to look at the NOA. Do you think it's adequately funded, one, by government and maybe other philanthropic organization, and two, are they really up to date with the mandates that they have?
Thank you. Are they adequately funded? The answer is no, they are not. And reason being that in every program of government, there is the mobilization, there is the enlightenment aspect, and there are funds made available for it. But it doesn't go to the NOA. I mean, like in this case, with the COVID-19, for instance, I'm sure the monies for mobilization and talking to the grassroots at that level will be domiciled with the NCDC, who doesn't have the wherewithal to so do. And they will not normally, invite the NOA to partner with them to draw programs. Like I say, 774 top government officials, some of them medical doctors, some of them architects, of every kind of spec. You get it in the National Orientation Agency. And as I speak with you, I know as a fact that even in this period, and even without funding, they are making programs. I know that here in Abuja, the NOA of Abuja here, the FCT, what's it called? Their commons are all over because you won't see them, because for you to see them, they have to have funds to be on your radio and television. But they are from the person-to-person approach.
But they have the government media to use too, to reach the people.
The issue is that government media also requires funding, payment for service. So it's not as if to say, because you are NOA and you are government media, I bring my jingles or what have you to play. They have to pay. That's unfortunate.
Mallam, not one jingle have we heard on this coronavirus, coming from the NOA, apart from the elitist one, which you mentioned, particularly the PTF, just talking to maybe the urban
yeah, but you don't, the issue is that jingles are the ones that will play on air here for you, television and radio. But there are the ones that they take to the grassroots level, which is local government, local theater, local theater at that level, and talk. And let me tell you, the only person known to the common man at that level, outside is National Orientation Agency. If you go to your local government, I'm sure, if you go to the grassroots where I know you're from Sapele, so where they do those things that Sapele people do, they know the Noah boss there. Because he's the one that they see as the only government that they know. So it's my take that government should utilize them more.
Everything seems to fall on Noah. Noah is not doing enough. Noah is poorly funded. Noah does not have the capacity. But we're not...
the issue of capacity, you cannot fault Noah. Anybody say Noah doesn't have the capacity, does not know, has not investigated, has not done a good research on Noah. Because if you go to research them and you look at them, I have left NOAA now for about 7-8 years, and I know exactly what they are doing. You get what I mean?
Okay.
But should they do more? I agree with you. Yes, they can. They should.
Yes, and in doing more, it's to get the traditional institution to, because they say they are closer to the grassroots. How about the religious organizations, the mosque and the churches? Is it because
they use
on
them
temporary shut down?
Chris, the truth is that they use them at that level. Do you understand? You go to Saminaka, a local government, rural local government in what's it called?
Kaduna State.
In Kaduna State, for instance, they only NOAA, the Christian Association. I mean, because NOAA is the more or less like the coordinator of all these other groups at that level.
So then, why is the ignorance still palpable? You talked about the grave diggers in Kano, for example. The same thing was saying in Yobe, in Zamfara, in Gombe, and the rest. No protective gears in all material particulars. So the spread is now gotten to the third level. Very dangerous indeed.
It is, and that's why I'm on this program, because I'm scared for my life too. So, NCDC and the committee should put in place, I mean, they are a committee at that level, but committees can also have subcommittees to do so many other things.
Yeah.
And this is where I think, in my opinion, all these NGOs that are grassroots oriented, that are grassroots based, should be. And these same people should be the people that you put together and channel palliatives to reach. Because like you recall, I said palliative is key to this, in this matter.
In getting the message down into the
Tell
people.
People stay at home, palliative you give them. And they will not come out if you take this palliative properly to them. And if they have a timetable to note that next week, by Tuesday, my own area will get the palliative. And let the palliative please be proper palliative. I do not like what I hear, that the ministry has sent 15 trucks of food items. We don't treat government like this. We want to know in these trucks how many bags of kaza, how many. There must be proper, what's it called? It's not a matter of just doing it at your whims and caprice. You just choose you want to send it to Kano because Kano is I like it, I send 10 trucks. You get what I mean? INEC holds election every year for the presidency. They go to the grassroots. Everybody, they catch them there. Using the INEC module. You can reach the people, but you have to please put in place a team so that we can be able to check. We don't take money and be giving people. Look at the opportunity lost, for instance. This face mask. If we are thinking out of the box and say there is no ward in Nigeria that doesn't have a tailor, and you give them, profile them, give them some money to be able to make this face mask so that these people can also be given free. We are killing so many birds with one stone. But really, this is time for us to be thinking out of the box. And I do not think that the way we are going, I think Mr. President needs to do a little rejigging, in my opinion.
Okay, Mallam, as an expert in information.
No.
Let us.
I'm not an expert.
Okay.
Yeah, but let us talk as common sense. I'm just using basic common sense.
Okay, that's all right. Fair enough. Let's look at the media management of COVID-19. How far, how well would you want to assess that?
It goes like this. A briefing at 3 o'clock. After the briefing, a few questions are asked. Incidentally, your Amaka has asked very, very good questions. I watch her every day. And my friend, it ends there. What else? What they should do, if they want to, in fact, even the media are not even properly used. I had one point. I told somebody, or one of them one time, I said, please, call Bon. Let Bon give you 15, 20 minutes of their airtime every day. But in doing that, they have corporate social responsibility. But you also have corporate social responsibility to their existence. So you get what I mean? If we have 15 minutes of COVID-19 in the over 100 and something stations nationwide, this thing will resonate. People will understand. And let it just be. But as it is now, you will carry it in the news, and that is end. And I do not think that they have made any provision. In all that they have, any money they have, they must provide for the media. They have to provide for the media airtime. We have 10,000 naira for airtime, but we know it wouldn't buy 15 minutes. It will only take 10 minutes. But you give us, you will cooperate. But they are not just doing it right. We're not going, all it just carries as news item. It's only as a news item. And it, at times it is, some other news item overshadows it because we're getting tired of the COVID, the approach there. So,
well, okay. In another enough minutes,
yes,
tell
sir.
us the way forward, because there's still no, solution to these solving these pandemic yet.
I joined the Pharmaceutical Companies Association of Nigeria in challenging them as to why are they not talking to them. I joined the Medical Association of Nigeria in challenging the committee, why are they not talking to them? And I also now want to state that for this pandemic to stay, lockdown is important. But for lockdown to remain properly locked down, we need palliatives. And the palliatives should be properly handled and managed. Please don't take 5,000 naira and take to the main road and give people and say you are giving palliative. You are only creating additional poverty.